Hello, I'm Bill LuMaye, and thank you for watching Community Matters. We hope you'll continue to watch as we discuss issues facing our community and provide you with the resources and information needed to find solutions. Many people are unaware of how common testicular cancer is, especially in young men. Fortunately, an organization in our backyard is working to raise awareness and provide education about testicular cancer. We're joined by Matt Cross, founder and executive director of the Raleigh Testicular Cancer Foundation, and a survivor himself. And Matt, thank you for being here.
Thank you for having me.
This is a very important topic. I mean, and first off, cancer in itself, when you get a diagnosis like that, that's scary stuff. You happen to be an individual who got that diagnosis. What was that like for you when they came in and said, "Hey, Matt, got some news for you"?
Yeah, so I was, I'm a local youth hockey coach. I work with children in the area.
Yeah.
And back in late 2019, I had a bump on my testicle. And typical guy, I was a little fearful of going to a GP and figured, when I had something important, like that wasn't important.
Right.
I eventually go get it checked out. And so I made my way to a GP and, was referred to go get an ultrasound, and it obviously ended up being cancerous, which, any cancer diagnosis, let alone one at, a young age of 36 years old, is incredibly scary.
Surprised? You had to be.
Yeah, definitely surprised. I mean, what I didn't know was it's actually the most common cancer for men 15 to 35. Women have done a really great job over the years with performing self-checks and tearing down stigmas associated with, health issues. And I think men, we're told to be tough and to toughen it out. And, being vulnerable and showing weakness isn't exactly something that we're comfortable with. And so, surprised, totally ignorant kind of on testicular cancer and the dangers of it. And so, had a bump and figured, it was going to work itself out, but, ended up being pretty scary.
Well, let's talk about the journey you went on, because now you've been diagnosed. Well, now they got a plan for you, and I've seen this myself personally with people that I love, and each cancer is different, each individual is different. What was it like for you?
Yeah, so with testicular cancer, when you get diagnosed, they perform what's called an orchiectomy, which is the removal of the testicle. Obviously had a tumor in there, so it's really dangerous, and so removing it is the first thing that they do. I then went through 3 cycles of chemotherapy, which went over about 12 weeks. And then I had an additional surgery called RPLND, where they essentially remove a tumor and the lymph nodes in my abdomen. Testicular cancer, the treatment actually is a medical miracle. So before 1980, the cure rate was less than 5%.
Oh, wow.
Yeah, so if you were diagnosed with testicular cancer before 1980, it was really, really scary. And fortunately, Dr. Einhorn, who's now a really well-known doctor who works at Indiana University, came up with the chemo concoction that now has pushed testicular cancer cure rates to over 95%, especially if you catch it early. So the chemo is done very heavy chemo in a short period of time. So the treatment is really, really harsh on men. But thankfully, if you catch it early, your cure rate, is very, very high. So obviously the importance of educating and bringing awareness to the disease so that men, perform self-checks so that if they do find a bump or something scary, that they get it checked out right away.
I was talking to you earlier and I said, a lot of the other cancers are really highlighted, right? We have football games. We know about breast cancer.
Yeah.
A lot of walks and marathons. And this happens to be the kind of cancer I've never really heard a lot about. And that seems important because men aren't going to self-check. They may not even know that they should. What should they be looking for? What are some of the symptoms?
Yeah, so I definitely agree. I mean, I think, Lance Armstrong is the kind of the one person that I think everybody remembers had testicular cancer, which was a public figure. I'm not sure exactly why that is. I mean, I think maybe because the cure rate is so high, it maybe doesn't get as much attention. There's obviously lots of stigmas with men's health in general. So we're always talking about not just bringing awareness to testicular cancer, but using testicular cancer as a vehicle to just talk about men's health in general, right? To tear down some of those stigmas so that men, are empowered by taking control of their health. And to your question, we always talk, especially with, testicular cancer survivors, everybody knows their body, right? Especially, down there. Yeah. And so if anything is abnormal, if it feels different, especially if it increases in size or if there's specifically a bump, that's definitely something you have to go get checked out. And don't make the mistake that myself and others make of, waiting and saying, well, I'll go to the doctor when I feel comfortable, or I'll go next week. And, catching it early is really, really important.
I think that's probably one of the great mistakes many people do is they put it off and then it could be too late. It's always better to know, isn't it? Right up front rather than waiting.
Yeah, it's incredible because I think, mentally you're so scared, right? Of, well, I have something going on and if I go get it checked out, it might be something really bad.
Yeah.
To a certain extent, when I got diagnosed, it was really scary. I went through all the emotions that, every, new patient goes through. But then there was also kind of like a weight kind of lifted off your shoulders, right? You kind of then have an idea of, what you have and a blueprint of how you're going to get healthy. And then you can kind of aim and direct that. So definitely it's much better to know and then be able to do something about it than not know and carry that anxiety. And then of course, waiting, it just gets worse and worse.
Well,
right?
Sure. All right, well, stick around. And Matt, I know you will, and we have a lot more to talk about. We'll be right back. We're back with Matt Cross, founder and executive director of the Raleigh Testicular Cancer Foundation. And Matt, I got to ask you, it's a personal question, I hope you don't mind, but you mentioned it's important to notice changes in your body. In this case, you talked about a bump. For men who may be watching today, what specifically are they looking for?
Yeah, so with mine in particular, it was kind of like a pea-sized bump that was attached to the testicle. A lot of men will have a very similar bump. It is connected to the testicle. A lot of men also see their testicle grow in size in a very short period of time. Those men usually have a tumor that's inside the testicle. We always encourage men to perform self-checks in the shower. It's the easiest, way to do it. So again, if you feel a bump of any sort, if it enlarges in a short period of time, that's definitely something to go get checked out.
Now, if you don't do it quickly, what eventually happens? Does it continue to grow? And then I'm assuming it becomes more difficult to treat.
Yeah, definitely. So catching it early in stage 1, where it's just confined to the testicle, is obviously your best bet. If you do let it go too long, it usually transfers up your abdomen. And where it gets scary is if it, spreads to other organs like right. your lungs or your liver or your neck or even up to your brain. So again, catching it early is really the key thing here.
Well, tell me about the foundation. What is it all about?
Yeah, so I was really lucky. When I got diagnosed, I'm actually originally from Canada, so my family all lives up in Canada. The local youth hockey community really supported me. And I was really blessed with all of that support. So when I worked my way into survivorship, I kind of wanted to continue my journey and continue my story. I realized there weren't a lot of men-specific organizations, and especially men-specific organizations that provided very personal support in our actual community. So it started kind of as an idea. We got together a board of directors and wanted to raise some money. And it's really grown over the last 4.5 years. And we're extremely proud of kind of who we are and what we do in the community. And so the main mission of the Raleigh Testicular Cancer Foundation is education and awareness about testicular cancer, but also men's health. But we also provide direct support to men. So the local healthcare institutions know about our organization and connect us with patients. I meet those men, it usually starts with a lunch or breakfast to kind of share stories and get to know each other. And then we provide need-based support. So that looks like attending doctor's appointments. It looks like sending them videos from other survivors to kind of provide some inspiration. It also looks like financial grants. There's a huge financial burden that comes with a cancer diagnosis. So we've provided over $90,000 directly to men right here in Raleigh. We're tearing down stigmas and creating conversations with young men. And yeah, we're really excited about kind of who we are and what we're going to do in the future.
What's that like to get down and really talk to someone about something pretty personal, but especially men? They're not really into, because we put on that strong front, but are the barriers knocked down because you have this diagnosis? You must have been scared. I know you must have been. To have someone who's been through it, how important is that? Yeah,
I do think that, and I get the feedback from men that connecting with other men that have walked the exact same path is very important. But what I will say is I've learned that men are actually starving for conversations like that. I think we put on this front that we don't want to be vulnerable and we don't want to have these discussions. But I would say, based on my experience, young men, older men, I actually think that they're very interested in having these depthful, serious talks about their health. And so when I meet patients, I think because I'm a stranger, they're able to open up. I always have said, I think we're more cautious to open up to people that we know because we're worried that they're going to judge us, right? If our brother, our sister, our mom, our really good friend, if we talk to them about something very serious, there's that fear that they're going to provide judgment. And we really care about judgment from those people. But when you're talking to a stranger, it's like, I don't know this person. And so you'd be shocked at how quickly men open up and have that discussion. And again, I think it's really been an eye-opener to how many young people in the community want to really engage in a conversation about health and about changing lifestyle.
And that's interesting. You've brought that up a number of times. Usually when you think of cancer, you think of old people. And this attacks people that are pretty young. And I bet they don't even think about it. I know when I was that age, I felt invincible, man. I didn't think I'd ever die. So are they becoming more aware? I mean, are they beginning to take that serious?
Yeah, so that's a really good point. It's the most common cancer for 15 to 35-year-olds, which again, I don't think a lot of people know. And if you think about it, men at that age are usually, just finishing up college and maybe are about to get married or have just had their first child. And so it's usually a really difficult time in their life to have to deal with a cancer diagnosis. And as you said, when you're young, you think you're invincible. You don't think that you're going to get sick. And so, again, I think providing education and awareness and tearing down those stigmas so that young men do become more aware of it. But I also will add that I understand that cancer is devastating for a lot of people. But with testicular cancer, because the cure rate's really high, as we talked about, there's a lot of survivors.
Yeah.
Right? And so I will say that it is a springboard and it can be a really amazing thing for men to have happen earlier in their life. Because now they have a new lens at how they see the world and where they fit in, and they're full of gratitude. And it really is amazing to see men go through a cancer diagnosis at a young age and then have that be a rebirth into something really amazing.
The foundation of the work you do is just remarkable. I mean, if there's somebody watching today and would like to get a hold of you, whether it be for just education purposes or could use your companionship, how do they do that?
Yeah, so our website is checkyouracorns.org.
Oh, I love it.
Yeah, our logo gets a lot of attention. It's a hand grabbing a few acorns, which ties into kind of Raleigh and the city of Oaks. It's a clever kind of witty way to address the topic, but also keep it classy.
Right.
We do everything that a lot of local nonprofits do, right? So we do a gala every year, we do a golf tournament, we do a Movember campaign. So finances are obviously really important, right? So we can support these men. So attending one of these fundraisers, for people that are interested, but also, getting a hold of our self-check posters or our self-check cards. And we also do presentations. So I'll go speak to business teams, sports teams, and kind of talk about the basics of testicular cancer. So anybody that's interested, or anybody that might have a family member that's diagnosed in the next 6 months or a year, obviously reach out to us because we'd love to be of service.
Well, you've educated me, and I appreciate it very much and for what you're doing, Matt. All right, so stick around. We got a lot more. We'll be right back. Welcome back. Matt's still with us. And Matt, I got to ask you something. I'm just curious because you went through chemo and you said it's pretty intense. What was it like for you? Because my daughter's going through it and it was terrible for her. I mean, and her biggest fear was losing her hair. You got nice hair too. So
I lost it.
Did you lose it all?
I did.
Okay, but what was that like for you? I mean, what changed in your life going through that?
Yeah, so chemo is a lot of waiting and a lot of time kind of spent doing nothing. Right. I think a lot of cancer patients will attest to, you're waiting in the waiting room, you're waiting to take vitals. And then with testicular cancer, you're getting treatment over a 5 or 6 hour period each day. And so there's a lot of time where you're kind of just sitting there with your thoughts. Myself, actually, because my family was up in Canada and it was during COVID, there wasn't as many opportunities to have people come and spend time. And so, I think it was really important for us when we started the organization to provide a patient support program, which is really personal. So I will attend doctor's appointments and I'll even sit with men while they receive treatment. So I'll go to the hospital and we can sit and we can kind of help fill that time by, talking about the cancer if needed and kind of side effects to help them through that, but also just kind of being there as a friend, right? To, share stories and have a laugh and kind of talk about life.
That is huge. That really is. In fact, we followed you in to a hospital visit. Would you set it up for us?
Yeah, absolutely. So there was an amazing guy, RJ. RJ and I really hit it off when we met each other. He actually went through testicular cancer the first time about a year ago. And we were there, supporting him. And unfortunately, his cancer came back.
Oh, wow.
So he's now going through a second bout of testicular cancer. And so, as I said, it's really important to kind of be there. I'm a big believer in showing up in person, right? And so, we go to the hospital, you sit with him, you have discussions, you kind of talk about things. And I know with RJ, it's been really important to kind of have somebody there that's kind of walked through it.
All right, well, let's be the fly on the wall. Let's take a look at it.
Sounds good. So we're at the Duke Cancer Center. I've been through chemotherapy, I've been through treatment, so I know what it's like to sit in that chair, and we're here to provide support for an awesome guy named RJ. And a lot of battles that men go through, especially during a cancer diagnosis, is mental. So we're here to hang out and share stories and have a laugh and just spend some time with somebody that needs that community.
So last July, actually on my mom's birthday. That's why I will never forget it. It was on my mom's birthday on the 23rd. I had a doctor's appointment to check out a hard spot on my testicle. And so I told my mom, I'm just going for a physical. I'll be fine. I'm gonna go, come back. My doctor was like, my PCP, he was like, I was like, what do you think it is? He's like, obviously they're not gonna be like, it's cancer, right? So he was just like, you know what, just in case, I want to get an ultrasound on this. It could be epidermitis, something like that. And so I was like, okay, a little bit of stress there, but I'm all right, fine. So I started and made an appointment for a ultrasound. Went back home that day, celebrated with my mom, cut the cake, and then I was like, all right, we're cool. Still on the back of my mind. Then I went to go get the ultrasound, which was very awkward, having an ultrasound done on your testicles.
Yeah.
And there's like 2 people feeling around for it. And I guess the lump was bigger than how in high school they're like an eraser sized bump. But I guess I've been holding off for so long, it was like half my testicle was like hard. And they're like, yeah, it is like most likely a cancer. And you're gonna have You're gonna have to get it removed, and then we'll check it out. We'll see what's going on. Then I went to the urologist. The urologist said the same thing, and he was gonna do the surgery. I went to surgery, like, I got my mind around it. It's just one surgery. I'll be fine. Got it removed. And then about 3 days later, once I was home and recovering, I got a call from my urologist saying, hey, we just did the biopsy. It is metastatic cancer, like non-seminoma or Pearson. I don't remember all the words. But it's not a bad thing, but I do have to go through some chemo. And then that's when like everything started. I got lucky and got connected with Dr. Ramalingam, who one of my family's friends also saw, and they're like, go to this guy, he's the best. And then before the first round, we met at like some burger place.
That's right.
And I think immediately I didn't realize how much easier it is to talk to someone who's been through the same thing. It was 3 rounds of 3 weeks. Got a CAT scan after that, and then Dr. Ramalingam was like, you're cured. I was like, beautiful, I'm cured. There's nothing left. I like pulled my hip flexor, which again, was maybe a good thing that happened because it made me want to go to the doctor. Because the first time, I honestly wouldn't have gone to the doctor if the testicle that had the cancer in it wasn't like, it got slightly infected. It had some sort of infection I had to take medicine for. But that's the only thing that took me to the doctor. And then this time again, I pulled my my hip flexor, tried to go some physical therapy. It wasn't really working. So I went to the doctor. We did an MRI, my pelvic area, the same area. And it looked like the cancer's come back. The same area of lymph nodes, one of them like grew again to like 6 or 7 centimeters. And then I was like, oh God, here we go again. So I went to Dr. Ramalingam. He was like, yeah, there was a small 5% chance that like this happens. It comes back if it comes back aggressively within 3 months, then this is the new program. This, whatever I'm going through now, which is like 2 rounds of TIP and then another 2 rounds of high dose chemo with some stem cell replacement. It's like they say, like when you're healthy, you have a million different problems.
Yeah.
But when you're sick, you have one problem. And that's just getting back to being healthy.
Yes.
And like, yeah, like you said, like there are those days where you just want to put your head down. It's like probably by the end of this week till like early or late next week, I'm going to be sleeping.
And when I come to the cancer center to spend time here now, I will purposely park on the 5th floor so that I have to walk down the 5 flights of stairs. Because when I was getting treatment, doing those 5 flights of stairs was exhausting.
Yeah.
Right? Like just getting up those flights was like a big freaking deal. So now when I come here, I'm like, oh man, I got to park there every time to remind myself, like, how lucky am I that I can walk those 5 flights of stairs.
Exactly. Like, I'm telling you, like, even there are days where I'm parking on the 2nd floor and I'm taking the elevator down.
Yeah.
Like, I just can't.
Yeah.
And like the things that little decisions like that, like one of the biggest things is like when I go to the grocery store or something, I'm not looking for one parking spot that's just close enough to the grocery store. I'm gonna go park in the back where all the bad people are not parking or good at parking, and then walk the extra 4 or 5 minutes that it takes to go into the store. And it's like, and I can do that and I'm not breathing hard and I'm not like exhausted. And it's like, it really is like something else to see like the lowest of the lows during chemo and then just doing simple everyday tasks after chemo.
Yeah.
And like you were saying, like during chemo, you can get like really down and depressed and all that kind of stuff, but that's why you have to have a good support group. Like, and for the people who don't have a good support group, like the stuff that you're doing is extremely helpful. I choose not to complain. I think I've just been like that even before the chemo, because I just had this thing, like just complaining gets you nowhere for me personally. Like it just makes me feel worse. It makes the people around me feel worse.
A lot of the decision making for you gets taken away when you get cancer, right? So there's all these things that are out of your control. And I think for you to say, you know what, I'm still in control of some things. I'm still in control of areas of my life. And one of those things is I'm going to choose how to act and how to view this, right?
Yeah.
And one of those things is, not complaining, right?
The best thing you can do is like make your reaction to your situation good.
Yeah, exactly.
Like in any, like this is outside of cancer, just in life personally, like you can't control your environment, but you can control your like reaction to the environment.
Yeah.
So like,
Yeah.
a little bit of philosophy in there for you.
Yeah.
I mean, that's amazing, man. I mean, thank you for what you do. It truly is incredible. And thank you as well for watching. We hope you enjoyed today's show. If you have any questions or would like to know more, visit our websites at RaleighCW.com and myRDCTV.com. I'm Bill LuMaye. Thank you for watching Community Matters, and we'll see you next week.